Hi, my name is Morgan Edwards, and I will be discussing the protozoan parasite Plasmodium falciparum. And for the higher order taxa, the domain is Eukarya, the kingdom is Protista, the genus is Plasmodium, and the species is Plasmodium falciparum. Now, for the scientific name, it is Plasmodium falciparum, but it can be referred to as P. falciparum. And when you consider the life cycle and the reproduction cycle, it does include two different hosts. Now, the two hosts are the female Anopheles mosquitoes and humans. And so when the mosquito bites the humans, it will release sporozoites through the bloodstream of the human. And these microbes will go through phagocytosis. And so it'll invade the liver cells when it's in the bloodstream. And when it's in the liver cells, it will mature to become schizomes. And these schizomes will eventually rupture the cell. And the natural host of Plasmodium falciparum are the female Anopheles mosquitoes. Now, for the characteristics and general structure of the Plasmodium falciparum, they're single-cell eukaryotes, and they're non-motile, but they do have stages in their life where they are motile. And these stages are sporozoite stage, the trophozoite stage, and the merozoite stage. Now, they are crescent-shaped when they're in the mosquito, but once they mature inside of the human liver cells, they do become more of a ring-shaped. And the chromatin inside of the Plasmodium falciparum is mass-shaped or diffused. And the disease that Plasmodium falciparum causes is malaria. Now, there are different microbes that do cause malaria, but Plasmodium falciparum, it causes the most dangerous type of malaria. And this microbe is able to infect many different species such as reptiles, birds, rodents, primates, and also humans. And the transmission is through the primary host, which is the female Anopheles mosquitoes. It can't be transmitted by person-to-person contact, but ways that it can be transmitted is through childbirth, from mother to child, and then blood transfusions, organ transplants, and if you share the same needles or syringes with people. And the symptoms that you will get are like flu-like symptoms. You'll get fevers, chills, discomfort, headaches, or nausea and vomiting. And you can also get diarrhea, abdominal pain, muscle and joint pain, rapid breathing, or rapid heart rates, and coughing. Now, these symptoms usually will begin within a few weeks, but sometimes the microbe is dormant and will sit for about a year, so you won't get symptoms right away. Now, for treatments, before you receive treatments, some good questions to ask are which type of malaria you have, the severity of the malaria, your age, and if you're pregnant or not. And the common drugs that you might receive are chloroquine phosphates and artemisinin-based combination drugs therapies. And that's when you use two or more drugs to work together and fight the parasite. And so some prevention measures that you can take is to apply mosquito repellent, drape mosquito netting over beds, use screened doors, wear long clothing, and specifically for kids to get the vaccine. This leads on to my interesting facts about malaria. Malaria is the third largest killer for 1-month-olds and through 5-year-olds. Through that age range. And in 2020, there were 241 million cases.